patient has to remember that a doctor has reasons not to believe you. And usually those reasons are financially tied. Either they don't have enough time in the visit and they don't want to create a long visit because they don't get paid for that. Or they don't want to actually admit to something seriously being wrong because it creates an insurance problem or a burden on the finances because you're stretching out a patient's visit and tests and all that stuff. So the doctors are trying not to believe you to keep it simple, and that's how they'll always want to go in the beginning. So you get this feeling that they don't trust you in the beginning, and when you tell them what's wrong, they don't like the answers. You know, this is how you feel in the beginning. Then it switches over. Then all of a sudden they stop believing everything you say and sending you out for tests and all that stuff because they've got the insurance company hooked. Once they get them hooked, whew, the sky's the limit. Then it goes another cycle later on, and it's long-term chronic pain, where they don't believe you again because now they're getting frustrated that things aren't working and they just want to end this. They don't want this long-term relationship with a patient. So now they're starting to say, I don't think what you're saying is true. You know, it's unfortunate. As far as the doctors go, my suggestion would be that a patient search out a doctor who understands pain. And I think the way to do that is right in the first initial meeting with them, ask them, I'm a chronic pain patient. Do you understand what that means? And let the doctor explain his belief system. Anyone who treats chronic pain in a new age fashion or the new way, they would start out the conversation with, oh, don't worry, I understand pain. I understand what you're going through, and I believe everything you're going to tell me. I believe all of it. So we're going to treat that, so don't worry about that. That when you begin a conversation that way, you put the patient so at ease because now they know they don't have to come in to impress you anymore. And a lot of times, this is where the doctor disbelief comes from.